Good afternoon, everybody. As Gail mentioned, last year we stood on a stage at an AGM and we described our strategic plan in theory, what we were planning to do for 2007-2008. So I'm pleased today to be able to stand here and tell you that we actually did it. And I'd like to spend just a few minutes highlighting a couple of our key activities. Our first strategic priority was to support the implementation of an integrated health system in Ontario through evidence-based policy and research. The integration report being released here today is a combination of various research projects under this theme, and I'm going to report the detail on that when we get to our panel discussion. Our second strategic priority was to improve patient outcomes through integration-related quality improvement projects. And we have a number of ongoing initiatives in this area, but I would like to single out just one. As Gail referenced earlier, we have partnered with the Association of CCACs on a series of quality improvement processes. The first phase, now completed, mapped out the community placement process in the Southeast. So we worked with staff from Quinte Healthcare and the Southeast CCAC, and we mapped out the steps it takes to place someone in a long-term care facility. And we also interviewed patients and their family members. To say it was an eye-opener is a little bit of an understatement. To get someone from the hospital to a long-term care facility took 160 steps. It generated 36 original forms and involved 4 separate trips to the hospital by the families who often did not live in the community where the hospital was. And it contained 15 points of delay. The process for making a bed offer was also quite complicated, a total of 53 steps, involving 5 separate staff members entering client information into a tracking pool 5 separate times. But they only generated 9 forms as opposed to 36, so they were a little bit further along. But as part of the research, we also asked patients what they wanted in this process. And this is a quote from a 65-year-old woman, which I think accurately sums up the feelings of the patients that we interviewed. I want accurate information that I can understand at the right time and place, including viable options so my family and I can make the right decision for us. I want to feel confident that people care and to be treated with respect. Staff in the hospital and the CCAC are now currently looking at ways that they can change their process. They found it a very invigorating project, and we are moving into phase 2 of the project, which we hope will be in Toronto. And for those who are interested in more of the detail, these results are going to be presented at the OAC-CAC conference in a couple of weeks in Toronto, and also will be on our website by the end of the month. Our third strategic priority was to drive informed debate through active engagement with decision makers. And we spent some time thinking about how to do this with busy people. We conducted interviews with senior leaders about how best to engage them. And what resulted was a dialogue model that we have branded Meeting of the Minds. Our first Meeting of the Minds was held in late May, entitled Lessons and Confessions from the Regionalized Healthcare Front, Where can they lead Ontario? We debated whether to focus on local governance structures to improve integration or whether to concentrate on primary care as a starting point. We heard about how regional health authorities do or don't involve clinicians in their planning and decision-making processes, and about the importance of bringing the public health sector to the table. And the session even generated some media coverage with a panel on TVO's The Agenda with Steve Paikin and a series of columns in the Toronto Star by Carol Gore, which I gather even caught the minister's eye. A summary of the lessons learned from that event will also be posted on our website quite shortly. This year was also our last year of providing support to OH Africa, an HIV/AIDS treatment center in Lesotho. As the importance of that work grew, so did the need for a sustainable and independent organization. Thus, OH Africa is now incorporated, has its own board of directors, and its inaugural CEO, and I'm going to ask him to stand up because I'd all like you to meet Daryl Perry over here. And I stress they're a charity, so donations are welcome. Over the year, we have also revamped our website, which I hope you've had a chance to visit, and we started an electronic newsletter, aptly named Top of Mind. If you aren't already a subscriber, you can sign up on the web. So it's been a busy and productive year. We even managed an office renovation in the middle of everything else and undertook new living arrangements with the Council of Academic Hospitals of Ontario. And lastly, like Gail, some thanks are in order here. I would like to thank the OHA for its ongoing administrative support and assistance and its member hospitals who have warmly embraced our new mandate. I would like to thank the Foundation's board, and in particular the board chair, Gail Donner, for their ongoing support, guidance, and for the many hours of volunteer time they put in on our behalf. And finally, I would like to echo Gail's thanks to the Foundation staff. It really is quite amazing what 6 determined women can do when they set their minds to something. Thank you.